Hello everyone, my name is Martine Ford and I will be presenting hypertension PowerPoint presentation. Chief complaint in HPI. Chief complaint, patient presents with complaints of frequent headaches and occasional dizziness for the past 6 months. History of present illness. Patient is a 55-year-old male who's been experiencing intermittent headaches for the past 6 months. He describes the headaches throbbing in nature, primarily occurring in the mornings and often accompanied by dizziness. Subjective data. Past medical history, hypertension diagnosed 5 years ago. He's been non-compliant with the medications due to his financial constraints. Past surgical history, appendectomy in 1998. Current medications. Patient is on amlodipine, 10 milligrams PO daily for hypertension. He is not fully compliant with his regimen. No known allergies. Family history. Father is deceased due to an MI at the age of 65. Mother has hypertension and type 2 diabetes. And one sibling has hypertension. Social history, patient is a non-smoker, occasional alcohol drinker, works as a construction contractor, and denies any drug use. Review of systems. General, he denies any fever chills. Cardiovascular, he reports occasional palpitations, but denies chest pains and peripheral edema. Respiratory, denies shortness of breath, wheezing and coughing. Gastrointestinal, denies any abdominal pain. Neurological, he does report occasional dizziness, but denies numbness and tingling to his upper and lower extremities. Musculoskeletal, denies joint pain and swelling. Skin, he denies any lesions or bruises. Skin is pretty much intact, according to the patient. And endocrine, he denies heat and cold intolerance. Objective. Vital signs, blood pressure is 160/95. The rest of the vitals are stable, as you can see. Physical exam. The patient generally appears well nourished. He's alert-oriented ×3. Neurological. Pupils, both pupils bilaterally are reactive to light and accommodation. Cranial nerves are grossly intact. No vocal deficits. Cardiovascular. S1 and S2 are heard. No murmurs. Respiratory. Clear lung sounds. Abdomen. Non-tender, soft. Skin. No redness or bruises. No pitting edema. And vascular-wise, 2+ pulses throughout. Capillary refill is less than 2 seconds bilaterally. Labs ordered were CMP, CBC, lipid panel, urine analysis, and ECG. Assessment. The working diagnosis is hypertension. Hypertension, as referred to as high blood pressure, is a medical condition where the force of blood against the walls of the arteries is consistently too low. I thought of this working diagnosis based on the patient's symptoms and examination findings. Differential diagnosis, I thought of 3. Number 1 is secondary hypertension, and this refers to as high blood pressure that is caused by another medical condition, for example, renal artery stenosis. Number 2 is medication noncompliance. This suggests that the patient's irregular use of antihypertensive medication may be a contributing factor. Number 3 is white coat hypertension. This refers to when the patient's in a clinical setting, especially a doctor's office, their blood pressure does elevate. Red flags. There are plenty of red flags, but the ones that stood out is the severe headaches, chest pains, shortness of breath, and severe dizziness and fainting. Other red flags are visual disturbances, decreased vision, sudden vision loss, severe fatigue, severe nosebleeds, and severe anxiety and or confusion. The plan is to initiate antihypertensive therapy. Given the patient's diagnosis of hypertension and elevated blood pressure readings, it's imperative to start an optimal antihypertensive therapy. Okay, what's recommended are starting the patient on ACE inhibitors, angiotensin II receptor blockers, and diuretics. Number 2 is education on medication adherence. Emphasize the importance of consistent medication adherence in controlling blood pressure and reducing the risk of complications. 3, lifestyle modifications. Trying to emphasize a healthy diet, which incorporates fruits, vegetables, whole grains, and lean proteins. Encouraging exercise, daily exercise, at least 30 minutes. Clinical guidelines. According to the American College of Cardiology, blood pressures should be, the normal blood pressure readings are less than 120/80. Elevated is when it's, the systolic is greater than 120. Hypertension stage 1 is when the systolic is 130 to 139, diastolic greater than 80. Hypertension stage 2 is when the diastolic is greater than 140. The systolic is greater than 140 and diastolic is greater than 90. Lifestyle modifications as first-line therapy includes dietary approaches to stop hypertension. Examples are the DASH diet, sodium reduction, weight management, physical activity. Pharmacological treatments, and 3 treatment goals. Target blood pressure should be less than 130/80 for most adults. Monitoring and follow-up. Blood pressure monitoring. Instruct the patient to monitor their blood pressure readings regularly at home with a validated blood pressure monitor. Provide guidance and proper technique and frequency of measurements. Encourage the patient to keep a record of their blood pressure readings and bring it to their next follow-up appointment. Also, ensuring that the patient does schedule their follow-up appointment within 2 weeks to assess their response to the treatments. Question number 1 for the class. Which of the following blood pressure readings falls within the hypertensive crisis range? A, 120/80, B, 140/90, C, 180/120, or D, 130/85. Number 2, which lifestyle modifications is recommended as first-line therapy for managing hypertension? Is it A, increased sodium intake, B, sedentary lifestyle, C, Mediterranean diet, or C, excessive alcohol consumption? Question number 3. Which of the following medications is commonly used as a first-line agent in the treatment of hypertension? Is it A, metformin, B, lisinopril, D, ibuprofen, or D, alprazolam? 4. What is the recommended target blood pressure for most adults according to the American College of Cardiology? Is it A, less than 140/90, B, less than 130/80, C, less than 150/90, or D, less than 120/80? And 5, which of the following conditions is a potential cause of secondary hypertension? Is it A, essential hypertension, B, type 2 diabetes, C, renal artery stenosis, or D, obesity? Thank you very much. These are my references, and I hope you all enjoyed my PowerPoint presentation. Take care.